us today in the latest of our Q&A series, the Ask the Expert series, specific to COVID-19 and cystic fibrosis. My name is Jeff Beach. I'm with Cystic Fibrosis Canada, and I'll be your host and moderator for today's session. Before we get started with our panelists, I'm going to just point out a few housekeeping items around the session itself. So all of the participants have been muted by Devin, who's overseeing the back end of things here today. This is, of course, to avoid background distractions and noises. We're all, most of us anyway, are working from home. We have multiple people in our homes also working from home or in school, in the case of my kids. So minimizing distractions will keep everyone muted unless someone is speaking from the panel. I want to thank everybody who took the time to submit questions in advance of today's session. We had some really great questions coming in that we'll be raising today. We'll do our best to address the questions that were submitted. This, I want to remind everybody as well, this is part of a series of COVID Q&A Ask the Expert sessions that Cystic Fibrosis Canada has hosted dating back to April of 2020. So all of those previous Ask the Expert sessions are available, and we've had some of them done in French as well, that are available for you to download and view at your leisure at our website, cysticfibrosis.ca. We're also currently working on a session similar to this one, specific to vaccines in French, and the date and time and other details on that will be announced shortly. But today's session will be an English language session specific to COVID-19 vaccines and the cystic fibrosis community. COVID-19 has obviously had a great impact on us all and generated some very specific questions and concerns from people with cystic fibrosis and their families. So in addition to the Q&A series, we've also built, as I'm sure most of you, if not all, know, we have a section, a COVID-19 section on our website that we continue to update regularly. And we would recommend that you refer to that often because the information is changing rapidly. And we are doing our best to try to stay on top of that and make sure that the information that you need is available to you in as close to real time as possible. In addition to the information that's available on our website, we of course offer more personalized information and support as well by either calling our office or emailing us. The email address, if you're looking for information and you can't find what you're looking for, whether it's COVID related or anything else pertaining to cystic fibrosis, is advocacy@cysticfibrosis.ca. Lastly, before we get into introductions, if you did not submit questions in advance, or if you think of some questions as we're moving through the session here today, we would ask that you please submit them in the chat here in the Zoom program and chat. And we'll keep an eye on those and try and get to as many questions as we can with our expert panel here today. So without any further ado then, in terms of the expert panel, we're very pleased to have assembled a great panel of speakers and people to help address some of the questions from the community here today. I'm going to call on each of them to provide just a very brief introduction to start with, and then we'll launch into some of the questions that we've received so far. So first of all, we have with us Dr. Larry Lands, who is the director of the CF Clinic at Montreal Children's Hospital. Larry, could you just quickly introduce yourself, please?
Sure. So as Jeff said, so I'm Larry Lands. I'm director of the CF Clinic at the Montreal Children's. I'm also a member of the clinic in Rouyn-Noranda, which looks after both adults and children. And I'm also a member of the lung transplant program in Montreal, looking after CF patients post-transplant.
Excellent. Thank you, Larry. We are also very pleased to have with us our Chief Scientific Officer from Cystic Fibrosis Canada, Dr. John Wallenberg.
Hi, everyone. It's good to be here. I don't know that I qualify as an expert, but I'm happy to be here. I've been with the organization now for 6 years, and I direct most of the mission program. And I would just add Larry Lands is also he's also one of the principal investigators of CF CANACT, our clinical trial network. So he's got a lot of experience in dealing with even new medications.
Thank you, John. Also joining us on our panel today is Dr. Valerie Waters from the Hospital for Sick Children, CF Clinic.
You seem to be on mute, Val. I'm not sure why. Because it doesn't look like you are. Devin, are you still around? Maybe we can go on to Anne for the time being, Jeff.
Yeah, we'll come back to you, Valerie. So we're also very pleased to have with us Dr. Anne Pham Huy from Immunize Canada. And Anne, perhaps we could ask you to just briefly introduce yourself as well.
Yeah, thank you for the invitation. Happy to participate. So Dr. Pham Huy, I'm a pediatric infectious disease specialist at CHEO in Ottawa, and also the chair for Immunize Canada, which is a national coalition of a variety of organizations that work to promote and educate on vaccines, as well as a liaison member on the National Advisory Committee on Immunization. So
Great,
happy
thank
to
you.
be here.
Thank you very much for joining us, Anne. We really appreciate it. And Val, do we have you with us audio-wise? Okay, maybe not. So we'll come back to that in a bit. These sessions, a couple of sort of disclaimers, I guess, before we get into some specifics. These sessions are, of course, not intended to provide medical advice. We always advise that you consult your CF clinic physician and clinic team with specific questions regarding your own personal healthcare circumstances. I will also add that some of the information that we're going to be speaking about today is specific to certain provinces. So please keep that in mind, that when it comes to the rollout of the vaccine and so forth, there are some specifics around how that's happening in different provinces. So I know that our panelists will do their best to address that, but just keep that in mind, that it's not the same, uniformly across the country in terms of how things are rolling out or being prioritized. So why don't we start off then, because we do have Anne with us today, joining us as a very special guest for this panel. We've been hearing from the Government of Canada and of course from the provincial governments, and with assurances that all Canadians who are eligible and want to be vaccinated will be as soon as possible. And of course, we're all putting a lot of faith in that, and this as a really important step to getting us back to, using air quotes, normal at some point. Anne, perhaps you could just kick things off in terms of your reflections around the general landscape around the COVID-19 vaccine situation here in Canada, how the distribution is going, and any sort of latest developments that you'd like to share with us to start.
Now, happy to add a few comments. And again, I always like to start any of these COVID-19 related talks with the date, because we are now February 2nd, 2021. And so it is possible that in the next few hours, things might change, or by tomorrow. But and I think you raise a very good question and topic. So last year, I think it was, the big question was if, are we going to get a vaccine? And so now the question now is when. You raised that point in terms of the government and the different challenges of implementing vaccine distribution. So I think we need to remember, sometimes it's helpful to just understand the landscape in Canada of how vaccines are authorized, who makes the recommendations, who decides who gets it when, and how and where. And so in Canada, I think to remember that our regulatory body is Health Canada. So Health Canada's role is to review the data from the manufacturers and efficacy, safety, and decide whether or not to authorize its use in the Canadian population. So that's Health Canada's job. After that, it works in conjunction with Public Health Agency of Canada, which then also reviews further data, provides information for the public on vaccines, which then also works in conjunction with a federal committee, which is the National Advisory Committee on Immunization, who then reviews the evidence on how to use the vaccine. So NACI, or the National Advisory Committee on Immunization, makes the recommendations on how to use these vaccines that are authorized for use. So NACI will never make recommendations on a vaccine that is not authorized for use. But NACI makes recommendations from a national perspective, probably a broader stance. And then goes down to how health is distributed in our country, which is provincial and territorial. And so then each province and territory will then take into consideration the recommendations, but apply it to their specific population. So as you know, COVID-19 epidemiology is a little bit different and varies across our very large country. And so that's the role of the province and territories to evaluate that and decide exactly how to implement or distribute. So their job is to provide the vaccine programs. Obviously, all of these is intersecting. And so, and especially nowadays, there's lots of, nobody should work in silos. So it's all integrated between federal and provincial, territorial, down to the local public health units, regional, and into your healthcare providers. So that, I don't know if that helps to understand a little bit, because we get a lot of the questions of, who's going to make the decision on exactly who gets it. And so that's in a nutshell how it works in Canada. I don't know if you want me to expand on that or to jump to something else.
No, that's very helpful, I think, as a start to our discussion here today. And like most items related to health in Canada, there are some layers of complexity and involved in how things are rolled out and how it might look different from province to province and so on. But that's very helpful in terms of a framework. I guess perhaps maybe, and you could comment on the vaccines that are actually available in Canada now and what might be on the horizon on that front as well.
Yeah, so it's exceptional to call COVID-19 a vaccine preventable disease, right? And if you look at the different vaccine platforms that are being used to develop, I think we have like over 200 trials with almost close to 80 different vaccine candidates. So there's many different types of vaccine, and people have to keep that in mind as we start to get newer authorized vaccines. So currently we have two vaccines that have been authorized for use in Canada. Both are what we call mRNA vaccines, which, it's been called a new platform, but it's been studied for at least 2 decades. So there is experience, but there's been no licensed product out there that are using the mRNA platform. But these are ingenious vaccines. Basically, they are using the genetic code or the recipe to make one little protein at the surface of the virus called the spike protein. And so it's instructing our cells on how to make that protein. So the vaccine only contains a little lipid bubble that contains that recipe, if you will, that's in the vaccine. Once it enters our cell, it then gets processed in the same manner that many of our basic biological or cell biology mechanism is used to make that little piece of protein that then gets presented to our immune system. So again, many different vaccine platforms exist. All of them have a commonality that they're trying to have us create an immune response without having to actually go through the actual disease. And mRNA, again, one question I get a lot is that, is it gonna change my DNA and all that? Well, it never enters the nucleus and never touches our DNA. So the short answer is no, it cannot, it can absolutely not alter our DNA or integrate into our DNA or create a mutant of ourselves. So, although you could argue we're all kind of mutants, but.
Thank you, Anne, and that is a great way to kind of kick us off here. And I believe Dr. Valerie Waters is now unmuted and we're able to hear you.
I think so. Can you hear me now, Jeff, or no?
Yes, we can.
Okay.
Yeah.
I'm not so technologically adept, so this is good. Thank you, Devin.
Great, thanks. Val, perhaps you could just quickly introduce yourself as well.
Sure. I'm a pediatric ID doc at Sick Kids, and I work in CF with the CF clinics across Canada, essentially.
Great, thank you, and thanks for coming back to do another one of our Ask the Expert sessions, and to Larry as well. We appreciate it. So a lot of the questions that we've received, we're trying to group them into themes. And one of the clear themes that's on everyone's mind right now is around prioritization. So I'm going to ask if Dr. Wallenberg could comment on the update and in terms of how CF Canada has been advocating for the prioritization of people with cystic fibrosis when it comes to vaccinations, and perhaps where we stand right now and with the information, at least as of, as you said, Anne, February the 2nd at 12 noon Eastern time in terms of where things stand at this point.
Yeah, happy. Thanks, Jeff. And just a quick note, I made the mistake of muting myself and I could not unmute myself. So Larry, you might be facing that at some point in time if you're asked to speak. That's an interesting question, Jeff, about prioritization. The first off is, will people with CF be prioritized? Because that's not necessarily a given. And certainly as of today, it depends on the province. So there are 2 provinces that have committed to prioritizing people with cystic fibrosis. In Ontario, phase 2, which is anticipated to start in March and run through July 2021 this year. Individuals at high risk with high risk chronic conditions and their caregivers are slated to be vaccinated along with certain other groups. And then in BC, which is kind of the same time period, it's a different phase. In their case, it's phase 3, and that runs from April to June 2021. People with severe respiratory conditions, including all cystic fibrosis and other patients, including asthma and COPD, will be prioritized for vaccination. Bear in mind that's really for people who are approved for the vaccine. So in most cases, that's ages 16 and up.
Thanks, John. And do you have any information on the prioritization of transplant recipients?
Yeah, so interesting. That's a really good question because as a lot of people are aware, people who are post-transplant are on some form of immune modulators, immune suppressants. And so we actually reached out to the transplant clinic here in Toronto to ask that question. And it is recommended that everyone receive the vaccine. Right now, the initial rollout doesn't have them prioritized, but there are efforts to ensure that individuals who are post-transplant do get prioritized.
Thanks. And to you, John, and perhaps anyone else on the panel, what are you hearing about caregivers in terms of, especially one of the questions that came in was particularly around the parents or caregivers of a young child with CF who might be too young to qualify to be vaccinated, him or herself. And will the parents / other members of the household be prioritized in that case from what you're seeing?
So we can't say for those provinces who aren't prioritizing people living with cystic fibrosis. In Ontario, we do know that we've received confirmation that the prioritization will include parents of children with cystic fibrosis who are below the cutoff age. We have not yet received confirmation of that in BC, but it would be something that would intuitively make sense if they're prioritizing that group, the people with CF already, and generally people with respiratory conditions.
Thank you very much, John. We're going to move into another area of sort of theme of questions that have been coming in, and that's around safety of vaccines. And perhaps I'll start by asking Dr. Waters if you could comment on the safety concerns that people may have. And I think some people's concerns come through the fact that the vaccines have been developed very quickly, relatively quickly. What are the known side effects, or what are other concerns that people may have around the safety of the vaccine at this point?
Sure, yeah. So the vaccines were developed quickly, but there were not any shortcuts taken in terms of the collecting of the data in terms of adverse events during these trials. So the Pfizer and the Moderna vaccines have both fully reported their side effect profiles short-term. The long-term safety data is still being collected, and this is an ongoing surveillance program because they were rolled out quickly. But in terms of the short-term side effects, it does appear to be quite a safe vaccine. Some of the side effects are common to many vaccines, including local injection site pain, Sometimes patients can get fatigue or headaches or fevers after the vaccine. Most of those are quite short-lived, and usually within 24 to 48 hours, those resolve. So it does appear to be quite a safe vaccine with just local systemic kind of side effects. But again, the longer-term data is still being collected for those vaccines. But so far, they appear to be quite safe. There have been some reported cases of anaphylactic reactions in very few people who have had a pre-existing condition of allergies. But in terms of other more serious side effects, we haven't really seen that. There was a report in a Scandinavian country, in Sweden, I believe, where their very elderly were vaccinated, and a number of those very elderly patients died after the vaccination, but it was thought to be related to the side effects of fever and perhaps some diarrhea and not eating, not feeling well enough after the vaccine that they may have actually succumbed to their underlying illness and frailty rather than directly attributed to a vaccine side effect that caused something like an impact on any end organ system. So in general, the vaccines are quite safe, but the surveillance continues for more long-term types of side effects.
Thanks, Val. And I'll pose this question to both yourself and also perhaps to Larry as well. Specific to people living with cystic fibrosis who are on modulator therapies, Trikafta or Cambia, et cetera, are there any known interactions or any special concerns for people that are on modulators at this point?
Yeah, so it's a good question. In both the Moderna and the Pfizer trial, they did include patients with pre-existing medical conditions or chronic conditions. So I think in the Pfizer trial, they had about 7% in each arm with chronic lung disease, and the Moderna was somewhere similar, about 4 or 5%. So it's very possible that CF patients were included in these trials, although we don't have the detailed data as to what those underlying chronic lung diseases were. Were they on modulators? Again, we don't have that specific data. I don't know of any evidence or data or any reports that would suggest it would be unsafe in those with modulators. I don't know of any potential, theory that why that would be unsafe. Larry can comment as well, but it's likely that patients may have been included in this trial with CF, but we just don't have that kind of detail from the publications. Sure.
Thank you, Val. Larry?
Yeah, so I agree. We don't have any specifics about CF patients who's been getting vaccinated and whether they've been a modulator. Certainly, there'd be a wider experience in the United States. But as Val said, there's certainly nothing in the modulators that would cause a cystic fibrosis patient to react differently to a vaccine. And the whole purpose of the vaccine is that you mount an antibody, an immune response. Certainly, we use the flu vaccine, which works in the same way. It presents a protein that you make antibodies to, and we know that that's well tolerated in CF patients, and both those not and those on modulators. So there shouldn't be any particular concern for people who are on modulators about receiving the vaccine.
Great, thank you both. We were commenting earlier around the prioritization of transplant recipients, and there was a comment that some may have seen in the chat from Leona Pinsky in BC that it's confirmed there that solid organ transplant recipients are included in the April to June phase in prioritization, which is great. Are there any, going back to the sort of the theme around safety, some of the questions we had were around the safety for people who are transplant recipients, and are there any concerns that they should be considering as well?
Okay, so this has been actually discussed amongst transplant physicians across the country. There is actually a study ongoing at the United States to track patients who have had solid organ transplants and their response to the vaccines. And a similar program is being developed in Canada. So two things. One, solid organ transplant recipients, judging by other vaccines tolerate and are able to mount the immune response. Certainly transplant patients, we never use a live vaccine, and none of the vaccines, certainly the Pfizer and Moderna, and certainly the other major ones that are closer to commercialization are not live vaccines. So that one, we think that transplant patients should be able to mount a robust immune response. And we think it should be well tolerated, but because these are new vaccines, we want to follow this a little bit up. So people are being asked that if they do receive the vaccine, that they notify their transplant center that they have received the vaccine and which vaccine they've received.
Thank you, Larry. Going back just quickly, and Ian is feeding questions to me on my phone as I'm going through the list of questions that we had compiled up front in advance here. One of them question came in, or point of clarification I'll pose to John and anyone else who might want to comment, is when we talk about prioritization and the fact that from what we've seen in the provinces, at least where we know this, that parents would be prioritized. Would that extend to other family members? For example, if someone is a spouse of someone living with CF, would that prioritization be extended to them, or is that just not known at this point?
Thanks, Jeff. So Leona actually had confirmed that they are not including family members in the prioritization in BC. So that was something in BC. In Ontario, we understand it was caregivers who are being prioritized and not just parents. At least that's the language that was being used. So we'll go with that. Okay,
great, thank you.
I just wanted to add maybe on the topic of prioritization, it's a very, very complex issue to decide. And it's the National Advisory Committee on Immunization put out a guidance on who should be, the key populations for prioritization, knowing that we were going to have a limited vaccine supply up front. So there are general principles, both some biological factors, so, things that are innate to the person's health and medical condition, but there are also societal factors. And the guidance was based on what we're currently seeing in terms of who is getting hospitalized, who is dying from COVID-19, where are the outbreaks, where's our highest transmission, how can we conserve capacity? So there are different stages of it. So this is a guidance that, again, then is brought to different province and territory for them to decide what is, who's going to get what and when, et cetera. So I just wanted to caution the audience that there's planning parts, but it doesn't, I wouldn't want people to be fixated on dates, because as it turns out, we're supposedly in, Q1 stage 1. So the initial priority was to give it to our so older age, an older age in a congregate living setting, so long-term care, retirement home, chronic care facilities. That has been definitely shown again and again to be the highest risk of hospitalization, death, outbreaks, etc. So it's been focused on that population, and then front-facing healthcare workers to preserve capacity, but also to decrease their risk of transmission potentially, and Indigenous communities. So those kind of like stage 1. But we're not even close to completing stage 1, as you may imagine. I don't know what's happening in the rest of the province or rest of Canada, but infectious disease specialists, or at least in my institution, see every confirmed COVID-19 patients, and yet we are not even close to getting our vaccines yet because of other issues. So I think that all of these. The goal is to get everyone vaccinated at some point, but it's a very tricky when you have to put into consideration all of these aspects and challenges. And, so I think we'll have to be patient, but I would continue to advocate for, your patient population for sure.
Yeah, thank you. And that's helpful and really helps us to understand a little more about how that prioritization works out and how it rolls out in the real world as well. So we appreciate those comments. In terms of another area that we've seen a lot of questions come in is around the efficacy of the vaccines and around questions around whether people who have already had COVID-19 should be vaccinated. So I'll throw that out perhaps to Valerie first, and Larry and anyone else who'd like to comment on that to provide some information and advice on, again, whether those who have already had COVID-19 should be vaccinated.
Sure. In terms of the efficacy in general, Jeff, both the Moderna and the Pfizer, which are mRNA-based vaccines, have been shown to be quite efficacious at preventing symptomatic COVID disease. So both of them are about 95% efficacious after the second dose. I think about a week after for Pfizer and about a month after for Moderna in preventing symptomatic disease. So these were short-term follow-ups in these studies. They went out to about 2 months. But they achieved their primary endpoint very quickly because of the high COVID rates in the U.S. So they are efficacious at preventing symptomatic disease. We don't have a lot of information about whether they're efficacious in preventing asymptomatic colonization and transmission to other patients or other people. So I think that data is still yet to come. Whether someone who's had COVID disease should be revaccinated, we know that from the natural disease, the antibody response varies, and the duration of that antibody response from several months to, I think, up to about 4 or 5 months. I think one publication has it as far as 8 months. But the immunity does wear off over time, and the antibody titers will likely drop. So, again, every province will have different vaccine requirements, but I don't think having had COVID prior is a reason not to be vaccinated, and I think that the vaccination would likely provide a booster to those antibody titers. So I don't think we have enough information to say if you've had COVID before, you don't need to be vaccinated. And I think that likely those patients would benefit, or those people would benefit from the booster response that you would get with the vaccination.
Thank you, Val. And we've also had some questions coming in around what we might know so far around how long we expect the vaccine to be effective. Is this something that you anticipate will become an annual vaccination requirement? It was one of the questions that came in. Or when considering new emerging variants, which we're hearing a lot about, do you anticipate that people will have to continue to be vaccinated into the future?
Well, I mean, they're really good questions, and they're questions I think a lot of people have, and I think the short answer is we just don't know yet. So there just isn't the long-term data to know how long this immunity, these antibody titers will last, and if it needs boosters beyond the 2 doses of the actual vaccine. I would imagine that potentially it might, and how the variants play into that, again, is a very rapidly evolving, changing kind of field that I just don't know yet, and I don't know if anybody really does. There's some evidence that the Pfizer vaccine is good for the UK variant, but these variants, they evolve quickly. There's a South African variant as well, which is now in Ontario. So I just don't think we have enough solid data to be able to answer that question yet.
Larry, Anne, anything you'd like to add to that?
Yeah, I'll just say, just to buttress that, I agree. We don't know how long the immunity is going to last. We do know after you get the vaccine, it's normal. It takes a while for your body to start producing antibodies. So the feeling is that the effect sort of hits its stride and really seems as full as possible after about 3 weeks. So it starts to kick in after 2 weeks, a little bit after a week, but really after 2 weeks, and really after 3 weeks. Everyone feels that you would benefit from the second dose, and as you know, there isn't data about how long you can delay the second before you get the second dose. But as we know, in Canada, there's a likelihood that there'll be a time gap between receiving the first and second dose, but generally antibodies don't disappear very quickly, so we probably do have more room on that. But as we know, when we talk about that viruses mutate, it means that the proteins that we've made antibodies to change a little bit, and so our antibodies just might not recognize the proteins because they've changed enough that the antibodies don't recognize them. So that you sometimes then have to change the vaccine, and that's why we make up a new flu vaccine every year based on the changes to the vaccine. So we may have to alter the vaccine, but we also, those antibodies might not stay around forever, and so we might need boosters on a regular basis.
Yeah, I'll just echo all of these things. So, I mean, in terms of efficacy, this is A+ in the world of vaccines. Both these licensed vaccines are incredibly efficacious, but we have to know what they were measured for. They were efficacious for in the short term, at least, shown by the studies. Obviously, these participants are going to be followed for 2 years, so we'll see the long-term data. No vaccine has 5-year long-term data at this point in the pandemic, we'll have to wait and see. So again, that's why a lot of people ask as well: do we need to wear masks? Do we need to physical distance even after receiving the vaccine? At this point, there's still a lot of unknown. We don't know how long the protective immunity. We don't know how long, if it protects against infection versus symptoms. And so if you have infection but no symptoms, you could still theoretically transmit. And so that's still a concern. And again, to remember in terms of mutations or variants, and this is a normal process for viruses to do. The question is this strain going to acquire enough changes or enough mutation that changes the protein significantly where the antibodies will no longer neutralize as well, right? And it's not necessarily a black and white or yes or no. There's some nuances and degrees to it. So we'll have to follow that very quickly, but very closely. But it's there's still a lot of unknown.
So I'm going to jump in here, Jeff, real quick. Does that mean then somebody who's already been infected with COVID might still actually be susceptible to one of the new variants? They could conceivably get infected a second time shortly after. Yeah. Or is that just something we just don't know?
It's possible with the new variants. Depends, as Anne said, how different they are in terms of their spike protein specifically related to the original, right? And I don't think we know that. Getting infected twice with the original COVID is very rare. It's happened. It's been reported, but generally it's a rare event.
Thank you. So just to build off Anne's comments around post-vaccine precautions, I guess, there's I think for some people there's a perception that, once you have the vaccine, you kind of roll up your sleeves and, get back to normal type thing. And, what do you anticipate happening? And maybe, we'll start with you, Val, because you're centered on the screen right now, at least on mine. But what do you anticipate to happen around these precautions like masks and social distancing? And, once we see more widespread vaccinations happening, if we were to fast forward maybe towards the end of this year, what do you think that might look like?
Yeah, it's hard to predict. I feel like no matter what I'm going to say, I'll probably be wrong. But, you do need a certain amount of immunity within a population before you could even start to think about doing that. And what that looks like, whether it's 60, 70%, 80% vaccinated or immune before you start releasing some of those. Again, these are speculations, and I'm not sure that people 100% know what the right answer is for this. But you certainly will need a good proportion of the population that's vaccinated or immune before you could even start to think about this. So I hesitate to say, like, when are we going to be able to take the mask off, Jeff? I don't know. You can ask Anne or Larry if they have predictions, but I'm not sure how to answer that one.
That's fair. Anyone else care to venture and go there?
Well, I ordered my crystal ball on Amazon, but it's still on back order. So no, I completely agree. It's going to be a combination of having enough of the population vaccinated, again, some kind of number no one knows, as well as continued surveillance and showing a decrease in circulation of the virus in the community. And also hopefully studies showing that these vaccines may actually provide, long-term protection, as well as I would love it for, decrease in infection, not just symptomatic disease, but also being infected with the virus. At this point, the studies we've seen have shown, preventing of symptoms with disease, but not yet infection. So I think it's going to be multiple factors, but I'm looking forward to that day.
And hopefully, when your crystal ball arrives, we can have you back for another session, and you can share that knowledge. That would be great. And hopefully, you use Prime for shipping, Amazon Prime. That's always helpful. But yeah, fair enough. I mean, I think at this point there are lots of unknowns, and that's, as we go back and if you review the other Ask the Expert sessions we've had since the beginning of the pandemic, there are things that are a lot clearer now that we didn't know then, and that will be the case as we move forward on the vaccine front as well, of course. One of the areas that there have been questions and concerns around is this whole notion of hesitancy around vaccines, and of course there's no shortage of opinions and contradictory sources of information that have led to feeding that hesitancy. So perhaps I'll pose this question to Anne, but Larry, Val, anyone, please jump in. What reassurances could you provide? You gave some reassurance a few minutes ago by saying that these are A1 vaccines and very safe and very effective. But are there any other perhaps myths to dispel, or any other ways that we can reassure people around the benefits outweighing any potential risks when it comes to these COVID vaccines?
Yeah, no. So, I mean, vaccine hesitancy is really the reluctance to receive a vaccine that are available. So, and it's really not, again, a black and white thing. There's a continuum. So I actually think it's completely normal to have lots of questions about vaccine. It doesn't make somebody anti-vaccine. So I welcome questions, and so I think the best way is actually to understand maybe vaccines, and to frame it in a way like, you're trying to prevent disease, which is actually it's not a theoretical thing. I mean, we've all seen COVID-19 around. It is quite true. So I think that, education is, and getting the right information is probably the best prevention or defense against hesitancy, and being able to talk to a healthcare provider or that you trust, who can provide this information as well, is very helpful. I'll tell you for myself, I mean, I work in vaccines. It's a big part of what I do. When the first word came out of, okay, these new vaccines, and the media likes to use words that might sound scary, really fast, never been used, these things kind of like, we've all been watching a lot of movies and all these conspiracies, so we're kind of in tune for that. So I'm gonna say, myself, I'm like, I need to know more about this. I'm not gonna roll up my sleeves blindly. But the more I learned about how these vaccines are made, and also the rigorous process of testing them, authorizing, these vaccines are not authorized lightly by Health Canada, and the amount of data that goes back and forth with the regulators and the manufacturers is incredible. And also being able to sit in these committees where you review the evidence. So before you even make a recommendation, I mean, this is like OCD, detail-oriented group of people. And so I feel very confident in terms of the process in Canada. Vaccines that are authorized for use in Canada are safe. And even when they're authorized, there's a whole other, it doesn't stop there. Things are continually being surveillance and monitored for that. So I'm very keen to get this vaccine. I'm anxious. You can tell I haven't received it yet, but maybe that's also a sign to boost confidence. Having read tons and tons about these vaccines and all these things, I would like, but I'll give my spot to the long-term care 80-year-old at this point, which is where they're going. But yeah, in terms of myths, I've heard, it doesn't go into DNA, it doesn't change your personality. What else? You can't get COVID from the mRNA vaccine because it's not a live vaccine. You can't, what other myths? There's no sterility. I've heard that as well. So I don't know if you want to throw more myths at me, I can address them, but I feel very confident about the process in Canada and about this vaccine. So if you ever get the chance to get it because the what we're seeing in terms of, COVID-19 disease is out there, and real, and I would not wish it on anyone.
Thanks, Anne. Just to shift gears a little bit in terms of the CF clinic, the transplant clinic settings, and perhaps I'll ask Larry for you to comment on this specifically around distribution and how you see logistically how you see this working in conjunction with the CF clinics, and also are there other questions that you're getting specifically from your patients that you might want to share with those that have joined us here today?
I mean, distribution, I think we've sort of touched on it. Really, I mean, each province is coming up with their own process for prioritization, but also how they're vaccinating. In my own hospital, some of us have had to go out to another place to get vaccinated, actually more than one place. And some people have gotten vaccinated in the hospital. And I'll say the rules change weekly on a slow week. But people have asked, basically two questions: should I get it? And they're really asking, is it? They're really asking about safety, and I think you covered really all. It's quite reasonable to question and ask, and we welcome all these questions. But it's also, I mean, it's important to realize how much COVID-19 is around, and it is. Can be a really devastating disease. And if we could put our finger on who exactly is going to get sick and who's not going to get sick, that'd be great, but we don't know. We've all seen enough cases of people who have no underlying disease have gotten quite sick. And we don't want to take that chance. So our druthers is we roll out the vaccine program, as quickly as possible. We've had a lot of hesitancy about people coming to clinic, and yes, we have modified to use telehealth and do virtual visits, and they do help to a certain extent. But as you know, there's other things we do in clinic. We do some testing in terms of lung function testing, cultures, chest radiographs that provide additional information, and we don't want people to miss out on it. And I think the clinics have been quite careful about infection control. I think actually it's interesting, all the CF patients were like, oh, now you know what the rest of us feel like, because we've always been very good about infection control. And I'd say especially the transplant recipients have been ultra careful. I will say, but it's been very stressful. So I'm in Quebec. We have lockdown. I tell all my patients that everyone is feeling anxious, a little depressed, feeling isolated. That's important to try and maintain good contact with people. I think it's important to try and go outside and get fresh air and do some physical exercise, not just for the physicality, but it's very good for overall morale. And that we do encourage people to reach out and get support, because there's a lot of people who are understandably having a very difficult time with it.
Yeah, absolutely. And again, we go back to how things have evolved and are ever changing, and that will continue to be the case as the vaccines begin to roll out as well. In terms of fresh questions coming in, a couple of questions we've had actually has been around allergies and allergic reactions, and what people might expect in terms of whether they have had some history of allergic reactions to allergy shots or flu shots, that sort of thing. Do you have any advice or information for those who may have those concerns?
So I'll just jump in there, because so A, I did receive my COVID vaccine. B, as a kid, yes, to an allergy shot, I did have an anaphylactic reaction. I mentioned that when I went to get vaccine, they gave me this funny look. I said, what are you talking about? But if you've had a severe allergic reaction, including anaphylaxis, seems that if it occurs and it's been very rare. But if it occurs really in the first 30 minutes. And people are asked to wait around 15 minutes. I think if you have any concerns, spending an extra 15 minutes waiting to see how well you tolerate it is time well invested. But the allergic reactions seem to occur very quickly if they are going to occur, and they've responded very quickly to treatment, usually like with Benadryl or so an antihistamine and sometimes an adrenaline injection, but that's been very uncommon.
Yeah, so just to follow up on that, so it's true. There's only one contraindication to this vaccine, and it is to a history of severe anaphylaxis to any component of the vaccine. So it has to be something you've been allergic to or had an anaphylaxis that's in the vaccine, or a history of anaphylaxis to the vaccine. So like you've had the first dose and then you developed severe anaphylaxis or anaphylaxis. So again, I've been on many meetings with different allergy groups as well, and this is posted by the Canadian Society of Clinical Immunology and Allergy. So even if you've had an severe anaphylaxis to different foods, peanuts, different drugs, it's not a contraindication, but completely agree you should be monitored a little bit more closely. 15 to 30 minutes. I would say 30 minutes is very prudent.
Thanks for clarifying that. We have roughly about 5 minutes left in our time here together for this session. So perhaps I'll just ask each of you on the panel if there's anything else you'd like to share, any other information that you think would be beneficial for our audience in the CF community as we continue to live through this process of immunizations and the evolution of the pandemic.
I can sheepishly put a plug to Immunize Canada, where you can find up-to-date information on vaccines and anything COVID-19 vaccine related. There's a lot of different resources for both patients, families, as well as healthcare providers, including webinars and all of that. So, but it is hard with the pace of information. I find it hard, so imagine, so things are changing very quickly.
Yeah,
So
absolutely.
I have a question that kind of relates a little bit to the immune reaction that people have. I mean, I've heard stories of people reacting very strongly to this particular vaccine. Healthcare providers who are well familiar. Is the way you react to the vaccine at all related to the level of protection that you have after having gotten the vaccine?
That's a good question. I mean, you generally, you want to elicit an immune response, which is, generally inflammation, et cetera. So that's why some of the vaccine you have these flu-like symptoms. And so, we think, but it's not, I don't know if it's the height of the neutralizing antibodies and all that have been measured, but that's what the theory is, that you've mounted a good immune response. But I don't know the exact, level of antibodies that you've mounted.
All right, thanks. John, Larry, Val, any closing thoughts or final words before we officially wrap up today?
No, not anything in particular.
Big thanks to everybody.
Yes, absolutely. I want to take this opportunity to thank everyone. Obviously, our experts on the panel today, Dr. Larry Lands, Dr. Anne Pham Huy, Dr. Valerie Waters, and our own Dr. John Wallenberg. And yes, John, you are an expert. We do consider you that. So thank you all for joining us and sharing your expertise and for entertaining these very important questions that have come in. I also want to thank everybody who took the time to not only join us today, but also to submit questions in advance. You really helped shape this session for us and make it as worthwhile as it can be. Just a reminder that this session has been recorded. So within the next few days, we will have it available for people to view again and download for those that want to go back to it and refer, or perhaps for those that weren't able to join us here today. And a reminder as well that we are putting together a French language session along these same lines, which will have some information and details to share with you shortly. So again, thank you for joining us today. We appreciate everyone's involvement and wish all of you well. And I'll just close by asking everyone to make sure we continue to take care of ourselves and our families, and let's stay close. And for those looking for information, please consult our website, as Anne alluded to, and Immunize Canada and other sources often, because the information is changing rapidly. Thanks, everybody. Have a great rest of the day.
Thanks, Jeff. Great job. Bye, everyone.
Thank you.